My name is Margaret Davenport, and I'm an associate professor in the Faculty of Kinesiology, Sport and Recreation at the University of Alberta. I was the chair of the working group who developed the Get Active Questionnaire for pregnancy, and I'm very pleased to host this webinar on how to use this new exercise pre-participation screening tool for pregnant women. I'd like to start by giving you a brief overview of our webinar today. We'll begin by discussing the SOGC CSEP 2019 Canadian Guideline for Physical Activity Throughout Pregnancy. We'll then talk about contraindications to prenatal exercise. Next, I'll discuss the development of our new pre-participation screening tool, the Get Active Questionnaire for Pregnancy, and the associated document, the Healthcare Provider Consultation Form for Physical Activity During Pregnancy. And finally, we'll complete this webinar by going through a few case studies. The SOGC CSEP 2019 Canadian Guideline for Physical Activity Throughout Pregnancy recommends that all pregnant women engage in at least 150 minutes of moderate intensity physical activity spread over 3 or more days of the week. Although physical activity is established to have many health benefits for the vast majority of pregnant women, there are medical conditions or contraindications where women are recommended not to engage in moderate to vigorous physical activity. These medical conditions or contraindications can be separated into absolute and relative contraindications. With absolute contraindications, moderate to vigorous exercise should be avoided. However, activities of daily living may be continued as directed by their healthcare professional. Many healthcare providers report that women who are told not to exercise end up essentially putting themselves on either bed rest or activity restriction. However, based on years of evidence, we know that bed rest is not beneficial and may actually increase the risk of depression, blood clots, bone density, and muscle loss. Absolute contraindications to prenatal exercise include ruptured membranes and premature labor, unexplained persistent vaginal bleeding, placenta previa after 28 weeks gestation, preeclampsia, incompetent cervix or cervical insufficiency, intrauterine growth restriction, high order multiples, so triplets or higher, uncontrolled type 1 diabetes, uncontrolled hypertension, or uncontrolled thyroid disease, and other serious cardiovascular, respiratory, or systemic disorders. In the case of relative contraindications, we encourage women to speak with their healthcare provider to discuss the pros and cons of exercise. With these conditions, some women may benefit from exercise while some may not. This should be an ongoing discussion with their healthcare provider, and modifications to activity are encouraged rather than complete cessation when possible. Modifications can include a decrease in the frequency or intensity and/or duration of exercise. Relative contraindications to prenatal exercise include having recurrent pregnancy loss, history of spontaneous preterm birth, gestational hypertension, systematic anemia, malnutrition, eating disorders, twin pregnancy after 28 weeks, mild or moderate cardiovascular or respiratory disease, and other significant conditions. The Physical Activity Readiness Medical Examination for Pregnancy, or PARMED-X for pregnancy, was first developed by CSEP in 1996 and is the only exercise pre-screening tool developed specifically for pregnant women. This was a comprehensive 4-page document that was designed to facilitate the conversation about prenatal exercise and contraindications between the pregnant woman, her healthcare provider, and qualified exercise professional. However, this document was 4 pages and viewed to be too long to be used in clinical settings. The requirement for all women to obtain medical clearance before beginning or continuing physical activity during pregnancy was also considered to be a key barrier to exercise participation when only a minority of women develop contraindications to exercise. A pre-screening tool is a document that is used to identify risk factors for adverse events during exercise and determine who should seek medical clearance. The Get Active Questionnaire is intended to screen in the majority of apparently healthy Canadians and follows the 2015 ACSM guidance. This document is meant for non-pregnant individuals and is intended to be self-administered to reduce barriers and healthcare visits. Due to the potential adverse effects of prenatal exercise in women with contraindications during pregnancy, it is essential that we identify women who have contraindications to exercise so that they can undergo additional screening with their healthcare provider. However, requiring all individuals to receive medical clearance from their healthcare provider prior to exercise has been identified as a significant barrier to becoming physically active. As such, the 2015 American College of Sports Medicine Recommendations for Exercise Pre-Participation recommends the use of a pre-screening process based on an individual's current level of physical activity, their desired exercise intensity, and the presence of signs or symptoms, as well as known cardiovascular, metabolic, and renal disease. In 2019, CSEP decided to develop a new exercise pre-participation screening tool for pregnant women that is more user-friendly, grounded in the latest evidence, and safely encourages and screens in the majority of pregnant women for regular physical activity. In December 2019, the Get Active Questionnaire for Pregnancy Working Group convened for a 2-day meeting with the objective to develop a pre-participation screening tool that can be used in both exercise and healthcare settings to identify individuals who should receive medical clearance. I was the chair of that working group, which included representatives from CSEP, the SOGC, College of Family Physicians of Canada, and Physiopedia. Researchers from across Canada, as well as 2 international experts, rounded out the working group. The Get Active Questionnaire for Pregnancy Working Group met for the first time for a 2-day strategic planning session in December 2019. At the end of that meeting, the steering committee took over for a few months to develop the outline of the Get Active Questionnaire for Pregnancy, as well as an associated document, the Healthcare Provider Consultation Form for Prenatal Physical Activity. Following consultation and revisions from the working group, that involved one-on-one interviews with healthcare providers to be able to determine the usability of these documents. The documents also underwent graphic design, and in 2021, the final documents were released. The key changes that were made to the Get Active Questionnaire for Pregnancy from the original PARMEDX for Pregnancy included the removal of the requirement of physician clearance for all pregnant women to engage in physical activity during pregnancy. This was previously considered to be a major barrier to physical activity during pregnancy and aligns with the new recommendations in the 2019 guideline. However, women are still encouraged to speak to their healthcare provider about physical activity during pregnancy. Another key change is that the working group worked very hard to make these documents much more user-friendly. On the first page of the Get Active Questionnaire for Pregnancy, women indicate some basic demographics at the top, and then they answer a series of questions screening for contraindications to physical activity during pregnancy. The questions are related to pre-existing medical conditions such as type 1 diabetes, pregnancy-related conditions such as preeclampsia or placenta previa, as well as other reasons that women may be concerned about being physically active during pregnancy. Once they've completed page 1, they then go on to page 2. The second page of the Get Active Questionnaire for Pregnancy includes questions about their level of activity prior to and during pregnancy, as well as their desired level of physical activity for the remainder of her pregnancy. This table provides the qualified exercise professional an overview of their level of activity as a starting point for more detailed discussions about physical activity levels. The second page also includes a small section providing general advice about the SOGC CSEP 2019 Canadian Guideline for Physical Activity Throughout Pregnancy, and a link to the more detailed guideline. The Get Active Questionnaire for Pregnancy specifically encourages that women who plan to engage in vigorous intensity physical activity or be physically active at elevations above 2,500 meters speak to their healthcare provider before engaging in these activities. The bottom of page 2 includes a declaration and client signature to satisfy liability insurance requirements for qualified exercise professionals. Based on extensive literature supporting the benefits and safety of prenatal exercise and the recommendations of the ACSM Roundtable, medical clearance is no longer required prior to physical activity participation. Although medical clearance is not required, women are still strongly encouraged to speak with their obstetric care provider about physical activity. If a woman answers no to all questions on page 1, she checks the appropriate box on page 2 and signs and dates the declaration. This form is then returned to the qualified exercise professional for their records. Physical activity is recommended. If a woman answers yes to any of the questions on page 1 of the Get Active Questionnaire for Pregnancy, they are required to speak to their obstetric care provider, either their physician or midwife, about the potential contraindications that have been identified. We have developed a healthcare provider consultation form for prenatal physical activity to increase the communication between the woman, her healthcare provider, and qualified exercise professional. Following the advice of the Get Active Questionnaire for Pregnancy, the healthcare provider consultation form for prenatal physical activity is taken by the pregnant woman to her healthcare provider to discuss the pros and cons of her being physically active during pregnancy. This document outlines the contraindication or other concern why she was recommended to speak to her physician or midwife. To aid in this discussion, an overview of absolute and relative contraindications are provided, as well as the general recommendations for physical activity throughout pregnancy. Following a discussion with their patient about potential concerns regarding physical activity, the healthcare provider can indicate if they recommend being physically active or not, as well as any modifications they may recommend. This can include unrestricted physical activity, progressive physical activity, recommending the avoidance or inclusion of certain activities, recommendation of supervision by a qualified exercise professional, referral to a physiotherapist for pain, impairment, and/or pelvic floor assessment, as well as any other comments that they wish to add. If beginning or continuing physical activity is recommended with or without modification, this document is then returned to the pregnant woman for further discussion with their qualified exercise professional. It is imperative to understand that this is not a medical clearance form. The physician or midwife is not signing off on this particular form. It is simply a consultation to provide general advice. On the back of the healthcare provider consultation form for prenatal physical activity is an overview of the SOGC CSEP 2019 Canadian Guideline for Physical Activity Throughout Pregnancy. It is designed to provide knowledge translation and general information for the healthcare provider. If their healthcare provider recommends physical activity with or without modification, the pregnant woman then checks the box stating that she has spoken with her healthcare provider who has recommended that she take part in physical activity during her pregnancy, and then sign and date the declaration below. It is really important to understand that at any time, whenever there is a change in their health, that this document be repeated. If their healthcare provider does not recommend physical activity due to any reason, including identification of a contraindication to prenatal exercise, the QEP cannot prescribe exercise to the woman due to the potential adverse effects on either mother or baby. However, as will be discussed in the next section, although exercise is not advised, activities of daily living can be continued as directed by her healthcare provider. Please continue to provide support and encouragement for a return to postpartum physical activity, and ensure that your client has appropriate help and support, as this news can be a significant source of stress to some women. Over the next few slides, we will go through 3 case studies which demonstrate how to use the Get Active questionnaire for pregnancy. In our first case study, we have Rashmi, who is 31 years of age with her first pregnancy. She was inactive prior to pregnancy and wishes to begin an exercise program. She is currently 8 weeks pregnant. To begin, Rashmi fills out the top of page 1 with her name, date, due date, number of weeks of pregnancy, and her age. She answers no to all questions, screening for contraindications. She indicated that she was not active before or during pregnancy to this point, but wishes to engage in moderate intensity physical activity for 20 to 30 minutes 3 to 4 times per week. As she did not answer yes to any questions, she can sign and date the declaration. Be sure to advise her that if her health changes during her pregnancy, that she should fill out the questionnaire again. Keep the document for your records. Physical activity is recommended. For case study number 2, we have Laura, who is 42 years of age with a twin pregnancy. She is currently 32 weeks gestation and has been active throughout her pregnancy. To begin, Laura fills out the top of page 1 with her name, date, due date, number of weeks of pregnancy, and age. She answers yes to question 1G, which indicates that she has twins and is 28 weeks or later. The rest of the question, she answers no. She indicated that she was active prior to and during her pregnancy, and she wishes to remain active for the rest of her pregnancy. However, as she answered yes to one question on page 1, she does need further consultation with her healthcare provider. Laura then takes the healthcare provider consultation form for prenatal physical activity to her healthcare provider to discuss continuing to be physically active during her pregnancy. After consulting with her healthcare provider, they determined that the benefits of physical activity outweighed any potential harms, and unrestricted physical activity following the 2019 guideline was recommended. Therefore, she checked the box that she consulted with her healthcare provider and signed and dated the declaration. Be sure to advise her that if her health changes during her pregnancy, that she should fill out the questionnaire again. Please keep the document for your records. And finally, for case study number 3, we have Emma, who is 25 years old with her second pregnancy. She is currently 18 weeks gestation and has type 1 diabetes with blood glucose values that are not stable. To begin, Emma fills out the top part of page 1 with her name, date, due date, number of weeks of pregnancy, and age. She answered yes to question 1H, that her type 1 diabetes were not stable. She indicated that she was active prior to and during her pregnancy. She wishes to remain active for the rest of her pregnancy. However, as she answered yes to one question, she does need to speak to her healthcare provider. Emma then takes the healthcare provider consultation form for prenatal physical activity to her healthcare provider to discuss continuing to be physically active during her pregnancy. Upon consulting with her healthcare provider, it was determined that she has an absolute contraindication to prenatal exercise because her blood sugars are unstable and not within range. It is recommended that she continues with activities of daily living but not engage in more strenuous activities. When pre-screening your female clients, ask if there is a chance they could be pregnant. If they are not pregnant, they receive the Get Active questionnaire. If they are pregnant, they receive the Get Active questionnaire for pregnancy. If your client answers no to all responses to questions on page 1 and signs and dates the declaration, you can provide fitness assessment and training advice according to your respective scope of practice. If your client answers yes to any question on page 1, she is then referred to the healthcare provider using the healthcare provider consultation form for prenatal physical activity. As a CSEP CPT, if your client answers yes to any question on the first page of the Get Active questionnaire for pregnancy, you then transfer the specific concern to the healthcare provider consultation form for prenatal physical activity. She then speaks to her healthcare provider. As a CSEP CPT without the CSEP specialization in pre- and postnatal exercise, you can only proceed if the unrestricted physical activity based on the SOGC CSEP 2019 Canadian Guideline for Physical Activity Throughout Pregnancy box is checked, and your client is not experiencing other complications that are not considered contraindications to prenatal physical activity. An example of this would be if they're experiencing gestational diabetes. However, it is your responsibility to recognize your area of expertise and refer your client to another certified member with specialized expertise as needed. As a CSEP CPT with the CSEP specialization in pre- and postnatal exercise, you can proceed with exercise prescription as recommended by the healthcare provider, as long as they have an otherwise uncomplicated pregnancy or are experiencing only one additional condition, such as gestational diabetes, which is not considered a contraindication to prenatal exercise. As a CSEP CEP, if your client answers yes to any question on the first page of the Get Active Questionnaire for Pregnancy, you again transfer the specific concern to the healthcare provider consultation form for prenatal physical activity. She then speaks to her healthcare provider. As a CSEP CEP without the CSEP specialization in pre- and postnatal exercise, you can only proceed if the unrestricted physical activity based on the SOGC CSEP 2019 Canadian Guideline for Physical Activity Throughout Pregnancy box is checked. However, it is important that you work within the scope of practice for a CSEP CEP. As a CSEP CEP with the CSEP specialization, you can proceed with exercise prescription as recommended by the healthcare provider. There are a number of other considerations for qualified exercise professionals working with pregnant women. It is important to ensure open communication with your client to address any concerns or changes in their health that may arise after completing the Get Active Questionnaire for Pregnancy. If her health status does change during pregnancy, it is critical to reissue the Get Active Questionnaire for Pregnancy to determine if any potential contraindication has arisen. You may want to consider pursuing the pre- and postnatal exercise specialization to ensure that exercise prescription is appropriate for pregnancy. For more information about the Get Active Questionnaire for Pregnancy or the CSEP pre- and postnatal exercise specialization, you can visit csep.ca or you can email info@csep.ca.